Welcome to Hiroshi Matsuda's Brain Imaging Complete 5. Let's log in. I will talk about cardiac sympathetic innervation scintigraphy in movement disorders. This imaging is useful in diagnosing diseases in which structures called Lewy bodies to accumulate in neurons. These diseases include Parkinson's disease, dementia with Lewy bodies, pure autonomic failure, and rapid eye movement sleep behavior disorder. Lewy bodies accumulate not only in the brain but also in the heart, gastrointestinal tract, skin, and so on. Accumulation in the peripheral autonomic nervous system results in pure autonomic failure, accumulation in the brainstem results in Parkinson's disease, and accumulation in the neocortex of the brain results in dementia with Lewy bodies. However, there is much overlap between these diseases. For example, Parkinson's disease is accompanied by peripheral autonomic dysfunction such as constipation and dizziness. This makes Lewy body disease a systemic disease. The diagnosis of Lewy body disease can be made by monitoring the cardiac sympathetic nervous system. The sympathetic nerve terminals conduct noradrenergic transmission. To monitor the cardiac sympathetic nervous system, meteodobenzylguanidine, MIBG, an analog of noradrenaline, labeled with the radionuclide iodine 123 is used. This drug is taken up by sympathetic nerve terminals in the same way as noradrenaline. Also, like noradrenaline, it is taken up by synaptic vesicles and released into the synaptic cleft. However, unlike noradrenaline, it does not bind to receptors and is not metabolized. Actual MIBG scintigraphy, imaging of the cardiac sympathetic innervation. A camera that detects gamma rays is taken from the front of the body. If normal, the heart is imaged. If abnormal, the heart is not clearly imaged. Cardiac accumulation can be expressed numerically as well as visually. For this purpose, the ratio of the counts of the regions of interest in the heart and mediastinum is taken and expressed as the HM ratio. The HM ratio is calculated from the early image 15 to 30 minutes after MIBG administration and the late image 3 to 4 hours after administration. Usually, the value of the late image is used. The early image reflects the distribution and density of cardiac sympathetic nerves. The late image reflects cardiac sympathetic nerve function in addition to the early image. Cardiac sympathetic innervation scintigraphy is helpful in the diagnosis of dementia with Lewy bodies, which differs from Parkinson's disease in that the Lewy bodies spread rapidly throughout the brain, including the cerebral cortex. Levodopa is effective in Parkinsonism. Levodopa is converted to dopamine in the brain and activates the dopaminergic system. The core features of dementia with Lewy bodies are cognitive fluctuating cognition with pronounced variations in attention and alertness, recurrent visual hallucinations that are typically well-formed and detailed, REM sleep behavior disorder, which may precede cognitive decline, one or more spontaneous cardinal features of Parkinsonism. These are bradykinesia, rest tremor, or rigidity. The first three typically occur early and may persist throughout the clinical course. Imaging findings are listed as biomarkers in the revised criteria for the clinical diagnosis of probable and possible dementia with Lewy bodies published in 2017. The reduced dopamine transporter uptake in the basal ganglia demonstrated by SPECT or PET and abnormal MIBG myocardial scintigraphy as indicative biomarkers, and the relative preservation of medial temporal lobe structures on CT or MRI scan and generalized low uptake of SPECT or PET perfusion or metabolism scan with reduced occipital activity as supportive biomarkers. Fluorodeoxyglucose PET may show a cingulate island sign. Indicative biomarkers are more important for diagnosis than supportive biomarkers. Compared to Alzheimer's disease, dementia with Lewy bodies has reduced occipital lobe perfusion or metabolism. Also, metabolism in the posterior cingulate gyrus in dementia with Lewy bodies is preserved in an island shape compared to the surrounding area, known as the cingulate island sign. Compare brain perfusion in dementia with Lewy bodies and Alzheimer's disease. It can be seen that perfusion in the posterior cingulate gyrus is reduced in Alzheimer's disease, while the occipital lobe is reduced in dementia with Lewy bodies. The medial temporal lobe shows less atrophy in dementia with Lewy bodies than in Alzheimer's disease. Colored areas show significant atrophy by voxel-based morphometry. MIBG scintigraphy in dementia with Lewy bodies shows no visualization of heart and markedly reduced cardiac sympathetic innervation. DAT scan showing dopamine transporter distribution shows markedly reduced striatal accumulation in dementia with Lewy bodies. Compare the findings of MIBG and DAT scan in Parkinsonian syndrome and dementia. MIBG scintigraphy is normal in multiple system atrophy, progressive supranuclear palsy, and choroidal degeneration, where DAT scan shows reduced striatal accumulation. MIBG scintigraphy shows decreased cardiac accumulation in Parkinson's disease, pure autonomic failure, and dementia with Lewy bodies. However, there is a type of familial Parkinson's disease in which cardiac accumulation is normal. Cardiac accumulation is also markedly reduced even in the early phase of dementia with Lewy bodies. How does cardiac sympathetic denervation occur? First, alpha-synuclein aggregates accumulate in axons extending from the paraspinal sympathetic ganglia to the heart. The Lewy bodies are the accumulation of garbage aggregates of alpha-synuclein protein, which plays an important role in nerve cells, due to its abnormality. The axons in the periphery begin to degenerate at the site of this aggregation, and this axonal degeneration progresses as alpha-synuclein aggregates accumulate closer to the ganglion. Even when there are no symptoms of Lewy body disease, alpha-synuclein aggregates may accumulate, and this is referred to as incidental Lewy body disease. MIBG scintigraphy was originally used to diagnose heart failure. Patients with heart failure should be careful in the diagnosis of Lewy body disease because the cardiac accumulation of MIBG is reduced. Cardiac accumulation of MIBG may also be decreased in patients with autonomic dysfunction due to diabetes mellitus. A report investigated how this heart failure and the presence of diabetes affect the cardiac accumulation of MIBG. The results show that diabetic patients with heart failure have lower cardiac accumulation than diabetic patients without diabetes or diabetic patients with similar levels of autonomic dysfunction without heart failure. Describe REM sleep behavior disorder as a Lewy body related disorder. Dreaming is common during REM sleep. It is another stage of sleep other than non-REM sleep as determined by sleep EEG and is characterized by rapid eye movements and decreased muscle activity in skeletal muscles. The English acronym for rapid eye movements is REM. In this disease, the mechanism of reduced skeletal muscle activity is disturbed, causing the patient to behave in the same way as in the dream experience. The patient may talk loudly in his or her sleep, raise his or her arms to look for something, or make violent movements such as punching or kicking. REM sleep behavior disorder may be associated with neurological disorders such as Lewy body dementia, Parkinson's disease, and multiple system atrophy. REM sleep behavior disorder may also precede the onset of these neurological disorders. A patient with REM sleep behavior disorder. There are no other neurologic findings. DAT scan shows the dopamine transporter is normal, but there is no cardiac accumulation on MIBG. Lewy bodies are likely to present in the cardiac sympathetic nerves. In this issue, we focused on the principles and clinical utility of cardiac sympathetic innervation scintigraphy. Thank you for watching.